Presentation is on the good clinical practice in Nigeria. The journey so far, it's to talk about good clinical history and the present conditions and the future directions of good clinical practice. Right? So my first slide is a summary of the presentation, and this tries to tell us that good clinical practice, otherwise abbreviated as GCP, is a very important aspect of any clinical trial. It is the aspect that ensures that trials are conducted ethically and guarantees that patients are safe, and also the reliability of the results. And it was adopted by the International Conference of Harmonization in 1990 and is now being used worldwide to ensure that trials are conducted safely. There is a history of unethical clinical trials in developing countries and Nigeria, and that necessitated this article in order to look at what has happened in the past and what is happening now and the future prospects of good clinical practice in Nigeria. Now, in Nigeria, a National Health Research Ethics Committee was inaugurated in the year 2006. Prior to that, so many institutions had review boards, but there was no oversight of their functions and they all acted independently. Recently also, a Nigeria Clinical Trial Registry has been set up, and it is quite surprising that these things did not exist in Nigeria prior to 2006. The major function of the National Health Research Ethics Committee is to provide oversight function of the individual institutional IRBs that already exist and the new ones that are coming up. Now, there are several concerns about clinical trials in developing countries, like in Nigeria. And these include that standards of care should be used in research in these countries similar to what is used in the developing world. And then sometimes, because of poor infrastructure, you do not have a good availability of interventions that will benefit the patients that participate in these clinical trials. There's also the question of the quality of informed consent. So overall, the aim of this article is to examine the awareness and utilization of GCP guidelines in Nigeria and to make recommendations for future practice, especially concerning clinical trials. So what are the questions that this study is trying to address? It is trying to find out if the siting of the clinical trials in developing countries that has been reported to be cheaper and subject to regulation is actually true, and that this has led to a recent trend of increasing numbers of clinical trial sites in developing countries. We don't have so many clinical trial sites yet, but it is obvious that because it is a developing country with favorable demographics, large population of over 150 million people, that this is going to be encountered very soon in the future. So what was the methodology for the research? A literature review using the keywords clinical trials, drug research, Nigeria, Africa, and good clinical practice, using sites like PubMed and Medline, Scopus, and Google Scholar to search for any articles related to these keywords. And this information was got from peers, government websites, and these were collated, reviewed, and summarized by the author. So what were the findings? It was found that the adoption of good clinical practice in every trial in developing countries like Nigeria may be affected by some challenges in a few aspects of the 13 basic tenets. Actually, GCP, there are 13 basic tenets of GCP, of good clinical practice, as concerns clinical trials. But it is difficult to achieve these 13 basic tenets in developing countries like Nigeria. First and foremost, something like informed consent from the trial participants may not really be adequate. We have a large semi-literate and illiterate population, and usually when the trial participants do not fully understand the risks involved in a clinical trial, there is no guarantee that they actually understand what they are about to participate in, and they just give informed consent without being really guided on what they are supposed to do. In addition, not many trials are approved by an institutional review board or an independent ethics committee. Because of this, it has been inaugurated the National Health Research Ethics Committee to ensure that every clinical trial sponsor has access to an IRB, no matter the location of the trial. Like I said earlier, the NHREC also supervises the other IRBs and ensures that GCP is well carried out during every clinical trial. Now, however, this is a recent development. Like I said, this NHREC was just formed in 2006, and so far there has been no evaluation of their function to know whether they are actually performing adequately and actually carrying out the task for which they were set up. Now, another problem with clinical trials in developing countries, according to the GCP tenets, is adequate training of clinical trial personnel. There's a real lack of clinical trial personnel in Nigeria. Not many people have been trained on GCP. And because of this, there needs to be adequate training of people that can participate in clinical trials. Now, in the recent past, a few people have started doing courses on clinical trials. Some of them are just certificate courses. Only very few people have been found to have a master's degree or a PhD in clinical research. There has also been an increase in the number of registered clinical research organizations. These are things that have occurred in the past 3 to 5 years. So in conclusion, this study has found that clinical trials are not adequately conducted in Nigeria, and the GCP tenets that have 13 basic rules, especially the aspect of informed consent for trial participants, are not yet being adequately utilized. There have been case studies whereby patients' rights were violated. There was a pharmaceutical company a few years ago that had challenges in the northern part of Nigeria, and this led to a lawsuit which has recently been settled by payment to the participants. These are things in the future, and it is recommended that there should be adequate training of clinical trial personnel, especially the medical care workers should go into research and should go into clinical trial training and training in GCP. And nobody should participate in a clinical trial as a trial investigator without having a proper GCP training. And it is important that the NHREC starts to regulate the number of registered CROs in the country now. It is still early days, and a lot can still be done to ensure that these things are nipped in the bud to avoid situations like what occurred with the pharmaceutical company that carried out a clinical trial recently, which ended up with poor response and poor health benefits to the trial participants, which unfortunately were children. Thank you very much. And my references as listed in the following slides. So like I said, the new clinical trial registration is a bold step in the right direction, and problems of poor health infrastructure, poverty, and low literacy levels make clinical trials to be very challenging. Government and non-governmental organizations have to step up and ensure proper regulation of clinical trials. Thank you for listening.